Item number 2, Commissioner Pelt, permission to solicit bids to asphalt overlay of 9/10 of a mile on Bevel Road and .3 miles on James Lane.
James Lane.
Yeah, in Pine Ridge subdivision on Ford Market 421.
So moved.
Second.
All in favor, say aye.
Aye.
All opposed? Motion carries. Now, Rosie, if you can be as fast on this next one.
I'm gonna do it real fast.
Okay, what Rosie's gonna do is she's gonna make a presentation on, the several different items that you.
Yeah, several different items. First of all, on the issue that we have to have, now all the part-time, temporary employees, on, if they work 30 or more hours, in an average per week of over 26 weeks, we have to offer them health insurance. I'm just gonna talk about this a little bit, and then I'm gonna talk about our policy that has to be changed, the wording in it has to be changed to accommodate that. And then Charlotte with TAC is gonna be here. When she called, she's on her way. She should be there in a minute. She's gonna do a presentation on the insurance, Affordable Care Act, on now and what you can expect in the future. Although we all know that nothing is written in stone for the future, but she wants you to be aware of what you might be looking at in the future. And then I'm gonna touch on an issue on the health insurance for retirees, and Angela's gonna fill you in on that one. There is a question that came up on that. And last but not least, I do have the renewal rates for the retirement, and I wanna go ahead and present that, so maybe then we can, so you have it for your budget, so maybe we can then act on all of this at next Commissioner's Court.
Next Commissioner's Court. Okay.
Okay, well, I did a sample for you, made an insurance. There she is. Hi, come on up here, Charlotte, please. This is Charlotte with TAC.
Good morning.
She came from Austin this morning.
Lisa?
Okay, I made you like, I made a calculator, to determine, whether the employees go over 30 hours and to see whether we have to supply them with health insurance. This is just a sample, and I started in July through December, and it spans 26 weeks, 6 months. There are three spans that Commissioners Court have to adopt. One is for 3 months, one is for 6 months, or one is for a year, and that's what they call the measurement period. I did a 6 months, and I would recommend for the court to adopt a 6 months measurement period, because 3 months I feel is not long enough, and a year is just too long. At the end of 6 months, if they have gone over 30, if they have 30 or plus hours, then we have to ask them if they do want to go on our health insurance. By doing this sample, there were 3 employees who went over 30 plus, and they will be going over 30 plus unless it's being changed. One is the employee in purchasing, but I feel like she's going to decline the health insurance because you can decline it. You don't have to take it because she's on Medicare and she probably will decline it. And then 2 dispatchers in the Sheriff's Department have. If you look on page 2, under the sheriff, on top it tells you what department it is. If you look under the Sheriff's Department, there are two that have gone over. And what this is I have to, every pay timesheet that I get for every pay period, I enter those in here. And then after the 26 weeks are over, the total time is then divided, so we get an average per week. And the last column shows you the average per week that each employee accumulated over that time. And we also have to include election workers, which we all know they're not ever gonna get 30 hours in 6 months, but we have to do the measurement on each employee.
Rose, before you go any further, okay, these, say the two dispatchers, okay, and they go over the 30 hours in this 6 month period. We have to start furnishing them insurance at what point?
After the 6 months are over, then we have to go contact the employee, ask them if they want to sign up for the insurance. It's just like any new employee, we have 60 days or whatever to sign them up. So then they stay on the insurance for the next 6 months. If the next 6 months are over 30 plus hours again, they can stay on the insurance. But if they were to fall below those hours, we can take them off the insurance. So it could be a putting them on, putting them off, putting them on, putting them off, situation. But we only have 3 employees, and I feel like that's probably not going to be, too much of an issue. But that's why I say 6 months and not 3 months or 12 months.
Rose, and I'm sure most of these part-time will decline because of the rates they have to pay. In fact, I see one here that's not even employed any longer. What cost is this gonna be to the county? I remember going to that meeting the other day at Lumberton Mud. We pay a certain rate and it fluctuates. Is it fluctuating on?
No, the employee pays $20 a month for health insurance.
Okay.
And the rate for the county is $779.88
Per person.
right now, per person per month.
So we're not paying based on a total number. We're paying individually.
Yeah.
Yes. So, but
Rose, I have a question. Isn't this mandatory under the Affordable Care Act?
yes,
So there's nothing the county can do about it one way or the other.
no,
And it doesn't look like a significant amount of money. So it's really not much that we can do, and so not much we ought to worry about.
well, but did you bring the estimated renewal rates?
They're not official. The board meets on Wednesday. I can tell you
But
it's going to be around 6,
Whatever
probably.
this contributes to our overall rate, there's nothing we can do about it.
No,
It's the law.
it's a lot.
Okay.
Well, the only thing you can do is manage the hours.
Right.
If
Yeah.
that's capable, if you're capable of that, if not, then there's nothing you can do.
Well, that was gonna be my next question. Should we have our department heads make sure? I mean, it's gonna be hard for the sheriff to have a part-time dispatcher that he's gonna have to keep under that. But for us from the county, do we need to make sure our department heads try to maintain a lower number?
Well, and that's why I made this calculator. I plan on taking one at the end of the month to each department, or they can always call them and ask me where they stand so far. But like I said, I've started another one now in earnest, and that one started April the 15th and goes through September the 27th, if the court approves the 6 months period, that is. But I don't really foresee any. I've talked to juvenile probation, I talked to maintenance, where most all of these are, and the tax office, and some of them are set up to $25 already. So, but yeah, the department head is gonna have to keep an eye on this, And also what we have to do at the end of 6 months, then we have to, tell y'all, we have to run a tape and calculate out to see in 2015, we have to have 70% of our full-time employees covered under the health insurance, and it goes up to 90% in 2016. If we fall below that, what happens?
Well, you have to offer, they don't have to take it, but you do have to offer 70% in 15 and 95% in 2016.
Based
Right
on
now,
the same criteria, or
Yes.
overall?
everyone who works an average of 30 hours a week. or
Okay,
more.
so it's based on,
Yes.
But
So-
we're good there.
so let's take the sheriff for example. If it becomes a cost effective, and like Mr. Pelt said, if we have to do it, we have to do it.
We have-
But for us, would it be more reasonable to hire 3 part-times and keep them under a certain number than it is to pay to this right here? I mean, I don't know what they make, but there's certain, different areas we can look at as far as it cost effective from the county. So,
Well, what you have to realize is, for one employee, it's about, let's say, $800 a month times 12, what the county pays. It's a little bit less than that now, but I don't know what the renewal rate is. So it's $8,000 times 12 for each employee that has 30 plus hours. Unless they decline to get on our insurance. They can do that, I have to have proof of the people that, they have to sign the form that I'm declining, I was offered, but I'm declining to take the insurance.
Okay, there's no doubt mathematically that if you can manage it so that they don't reach 30 hours, it's advantageous to the county.
Oh, yeah.
But is it advantageous to the county, and can the county get their work done?
Correct.
You got two things. You're gonna start, is it gonna become Hardin County's policy that we manage like Walmart or something, I'm just using them as an example, that we try to manage to the lowest dollar and not balance out what effects it has on the ability to get the work done? I mean, I can see that if you take if you can get 3 people to work 10 hours a week, it certainly helped the county stay off the insurance costs. But what about the gymnastics and logistics of trying to get 3 people in there to do that one job?
mm-hmm.
I mean, you're talking about nightmares, it looks to me like, in some of these things.
I think in some jobs that work, other jobs that won't work.
Yeah.
If I could interject, the 70% and 95% numbers, if you're only talking about 3 people, I mean, you certainly for 2015, at 70%,
that's-
you're
and
not
this
gonna
thing-
have to.
this thing is so up in the air right now.
Yes,
Yeah.
it'll change. I
It
mean,
may collapse under its own weight,
right.
and I don't know that, that whatever we do now may not be good next year, and so, and then the full effects, as I understand, are gonna be in 2017 after the presidential election. That's when all the taxes and
Yes, sir.
pages and pages and pages of regulations that are not even developed yet. So we may be doing a lot of worrying over nothing.
Well, and then, my question is, if you're that close to full-time, would it be more advantageous to make them full-time? If you're gonna have to pay for them anyway? If you're gonna have to
There's
pay
more
that.
benefits that come into play as full-time than what we're dealing with here, and I don't know what the difference in cost would be.
Well, the part-time temporaries, they of course don't have any benefits as far as sick time and vacation time. That is gonna be the only benefit other than retirement that's gonna be added to those categories of employment.
Part-time has retirement? Or no? So they,
Temporaries are.
so they already accrue in retirement and,
Rose, you said you took 6 months. Did you do the same analysis, same formula for a year?
No, because
A
it's.
year would give you more time to get that percentage down, up or down, and every 6 months, if you've gotta take a person off the insurance and put them back on, back and forth, that's kinda confusing. I mean, it can't be no simple task.
Well,
In a year's time, you got a little more leeway.
it's gonna be pretty much.
I mean, you must have a pretty good reason for picking 6 months, why?
Yeah, because 3 months I felt like it's not long enough. In a year, I feel like it's just too long to keep up with it all. 6 months to me seem to be the easiest time frame to work with.
Well, I feel like that, but I think it ought to be a year.
These will all be agenda items in the next Commissioners Court meeting, so we can, vote on it, but, in the meantime, reason we're presenting it today is that so that you can think about it, so when it comes up on the agenda. And when it's on the agenda, then we have a way of tracking it later on if we need to research it.
Yeah, and I'm inclined, I mean, you're 13 hours a week away from 2 full-time positions. I'd be more inclined to make them full-time. I mean, because you're gonna pay retirement and insurance on them anyway.
Aren't most of these in the sheriff's department and juvenile?
I'm sorry?
Aren't most of these in the sheriff's department and juvenile?
Most
I'd be
of them
interested to
are-
hear what their thoughts are on taking on more full-time employees as opposed to managing part-time.
Yeah, I mean, it's,
You're awful close.
I mean, if you see now pretty much as the timesheets come in, that, most of them are gonna be under 30 hours, except for those 3. And it doesn't really matter if it's 3 months or a year, it's still gonna be the same outcome, I just feel
You've
like-
got 6 more months to get that average down, was what I was thinking about.
Probably not gonna get the average down, cause they could pretty much, but, I mean, it's up to y'all, whatever you wanna do.
Well, why don't you figure it? I mean, you're just self-centered on 6 months. Figured on 6 months and a year.
The 3 that, actually went over, we have both department heads here now. How about Miss Unruh?
Yes, sir.
Is that gonna stay about the same?
Yeah, she's pretty consistent. We usually don't have to do.
And I know the dispatchers is gonna stay the same. I don't know if you heard Commissioner Pelt or not. From your point of view, would it be better for you to have these 2 positions as full-time or part-time?
Well, Trudy should be full-time.
Trudy's on Medicare though. Yeah, she won't take the insurance. She's
No,
already
she
told us that.
Right.
Do what?
She won't take the
Trudy is on
insurance.
Medicare, she'll decline the insurance, so it's basically just the 2 dispatchers,
And that's probably how it's gonna stay,
yeah,
once you do your averages.
right.
Well, I really think the department that is affected by it should analyze it, should get with you, and should come to the court saying, I really could do this better with a full-time than 2 part-times or something. They're the ones that's working them, and then the court could make a decision, probably if full-time's better than part-time and stuff. They know how to manage their departments. Yeah. What are we gonna be asked to vote on the next court, Judge, you say?
We'll have these agenda items of 6 months or a year or whatever, we'll have that and several other items that we,
Yeah,
but that way we have a tracking device in case for the future.
if you look at the policy, when I gave you copies, the policy on insurance and the miscellaneous policy, you have the way it is reading now, and then the new wording, because we have to adjust the policies to comply with this. And the wording has been looked over by TAC and by Ms. Rebecca Walton, and they both are good with the wording on it.
Is this the new ones?
The one on top is the new one, and the one on the bottom is the old one.
All right, and if I can go back to, what we're looking at on the averages, can you provide an accumulative total for 1 year for us before court next Monday and let us look at the 1-year average?
Well, I could go back, yeah.
Because it's hard to make a real comparison if you don't have the numbers. If Commissioner Pelt, what he's saying is, if in 1 year it goes below 30, then that may be the way we need to look at it. If in 6 months, in other words, if it doesn't change, then
Probably on some of these, you couldn't get a year out of
Right.
because
No,
They come and go so quick.
They come and go, for sure, the temporaries, you know.
What about the three? Can you give us a cumulative total of the three that's really impacted?
How about I do on juvenile probation, on the sheriff's department, and on maintenance?
I mean, that's up to you, that's a lot of work, when really we're looking at 3 employees.
Well, I can do just the 2 departments. I can do it whichever way you want to.
What do you think, Bobby?
I don't know, I think we'll have to have a comparison.
Okay, you want me to do
Because
one?
right now, we don't have nothing to compare it with, so
Can we do-
what are we gonna be voting on next time?
Right, can we do sheriff's department and purchasing?
Sure.
Since that's the 2 we're really looking
Yeah,
at?
that's,
I mean,
I have
if-
no problem.
If we're gonna be voting on it, we need something to compare to vote.
Do you mind getting that to us before Monday?
No, I can get it to you on Monday, not a problem.
Thank you.
Yeah. Okay. So, and then those are the policies that I'm gonna present for approval. And then, on the policy on retirement here, there are 2. One is on the retirement and one is on separation. And those I'm gonna present next Commissioners Court too. And basically, the question is on insurance. Currently it reads, in order to qualify for retiree insurance, the retiree must be receiving a retiree annuity or qualified to receive a retirement annuity. Insurance coverage must be elected at date of retirement. There cannot be a lapse in insurance coverage. And I'm gonna ask Angela to elaborate on this because she would like to have a change made to the wording on that paragraph.
Well, basically, we had this come up because someone left, and at that time, they did not retire, they just left. And then they came back and decided that they're going to retire. So I asked the question, shouldn't they make that decision upon leaving the county? Should they retire, or are they just leaving? In case, like someone is not renewed, someone resigns, I just feel like they should make that decision to retire at the time of the departure instead of coming back a month or 2 later and decide to retire.
Unless I'm overlooking it, I don't see it here, and it might not be in here, but I was looking at a, prior outside audit that we had, and it shows that the county provides, county pays half of the insurance for someone up to the age of 62. Is that still in effect?
65.
65, okay.
Yes, that's correct.
But that's something that we've been looking at each budget time because it's adding significantly to our modifier, isn't it? Whether we do 50% or 75% or stuff like that
Well,
on
that,
retirees.
On the retirees, basically, let's say we pay $780, so the county pays 50% of that, $360 for each retiree, and we currently have 6. Now, 2 of them have spouses, but currently we have 6 employees on the health insurance, and they are retirees. So, you can change the percentage. We can leave it like it is, or you can pay 100% of the premium. It's up to you. But Angela, the question she had is that they should make a decision at the time of when they leave the county, rather than wait. Leave the county, resign, and maybe gone 6 months, a year.
What would TAC do if you had person A separate from the county, 90 days later come back and say, well, I just want to make it official and retire? Would they have to prove proof of would they have to undergo any test prior to being placed back on the coverage? Because once an employee separates, they lose coverage, right?
That's correct.
Yes.
Right. So if they've lost coverage, then is there any type of proof?
Well, I'm gonna say a couple of things. First of all, I'm not aware of a TAC rule with regard to this, but I don't know of a county that I've been involved in anyway that doesn't have this rule in place. When an employee leaves, if they're not retiring, they're not eligible for the retiree
Anyway.
insurance.
But I agree
And
with
they
that.
can't come back, like what you're talking about. They can't come back in 3 months or 6 months or whatever and say, okay, now I'm retiring and I want on the insurance. Typically, that's not allowed. If you're leaving the county and you're not retiring, your options are COBRA, which you can pay yourself for up to 18 months to keep to continue that coverage. But if you don't do that and there's a lapse, then no, unless you were rehired and then retired, you'd have to be rehired by the county and then at some point retire to be eligible to stay on as a retiree. That's the first thing, but that's a county policy. If in this example you do allow them to come back and decide to go back on, under Affordable Care Act, there's no pre-existing condition limitation anymore, so no, there's
Is
not.
that in
really
effect today?
Yes, sir.
So they wouldn't have to prove eligibility again.
No. No.
Okay, let's say a person has 30 years, they're eligible for retirement no matter what their age is.
Mm-hmm.
But they don't want to start drawing their retirement, they're gonna go out in the private industry and get them a job and go to work. Okay, a year later, they don't like private industry, they decide, well, I'm gonna come back and retire. And since I'm gonna retire, I'd like to have this insurance until I'm 65 and the county pay half of it. Is that what we're talking about?
Yes,
Okay.
that's how it is currently set up.
Okay, and so what are we being asked?
You're being asked, do you wanna continue that practice, or,
Say if you don't take it now, when you leave, you never
you
get it?
can't come back and get it later when you draw a retirement check, when you actually do start drawing a retirement check.
Right, that's correct. Just changing your policy to say they have to make a decision on separation of the county, and they can't come back later and decide to retire and collect insurance.
I will add that part of the reason that counties establish that policy and don't do what you're talking about is the adverse selection issue, which is to say, I feel great today, I don't want to retire, whatever, and then something happens and they're really sick and they come back and they want to
Yeah, a
get
year
on, which
later you
affects
find out
your-
you've got a heart condition and,
Right,
you
which
know,
affects
private
your
industry's
plan
harder than what
and-
you thought it was gonna be, and so you wanna get back
Yeah.
in.
So you have to think about the effects on your, the effects on your plan.
Yeah, go in business yourself, you know,
Uh,
you got a back injury and you need an operation, I know all that, Luke.
Okay, that's something we'll have on the agenda.
Yes, I just wanted y'all to decide, thought it'd be good to talk about it, so y'all can think about it and then decide what you wanna do, before I change the policy. Okay,
Are you gonna be recommending a change?
well, if you leave it like it is, you have this thing sitting out there where, I think it'd probably be better for the county to go ahead, maybe to put it in place that they have to decide it,
Okay.
but it's just kind of sitting out there then if you leave it like it is, How long, they'll resign from the county 5 years, and after 5 years, they decide to draw a retirement check, and then they're gonna come back on insurance,
How many we don't have many that this is a possibility, do we?
It has only happened one time, and it's just happened recently, but there was only 1 month in between, and at that time, TAC had said it's really county policy, whatever, we do, but, you have to also think, if, anytime somebody has, like you said, they go and then 2 years they wanna draw a retirement check and get back on the county, and they have bad back, well, then that's gonna affect our rate possibly if there's a big $200,000-300,000 claim, it's gonna affect our rate.
If they were gone 30 days, did they lapse coverage or were they still covered?
I'm sorry?
If they were only gone 30 days, did they lose their coverage or were they still covered?
But when they leave, that's it, you
Yeah,
know.
you're
that-
not-
that-
But if you pay a premium one day, you're covered for 30 days, right?
it's-
If you
yeah,
get into the new
always.
month.
It doesn't matter what day, doesn't matter what day of the month that you leave. The insurance is always good through the last day of the month.
Right.
So if they leave
That was my
July the
question.
2nd, then
Yeah.
the insurance will be good for the rest.
Right, and that was my question. Did they come back during the time they still had coverage? Even though it may have been 30 days, if there's 31 days in a month, they still may be covered.
Yes.
And so was this person still covered or?
This person was over 65, so
It
it didn't
was.
affect the premiums.
Is this policy change gonna be on the agenda for next Monday?
Yes.
Okay.
I'd like to.
Okay.
Okay. And the next thing is on that policy on retirement, there's policy on separation, and that's just really simple. It currently reads a retirement shall be any situation in which an employee meets the requirements to collect benefits under the county's retirement program and voluntary letters to leave employment with the county. So it doesn't matter if they leave voluntary or not voluntary, they're still gonna be able to draw a retirement check if they meet the qualifications. So I'm just gonna propose to scratch the last line of that paragraph.
Okay.
And then last but not least, on the retirement rate, and this is also gonna have effect on the budget, is our current rate is 14.31%, and that's for the retirement and the insurance, life insurance. And when I got the rates back for this time, it has actually gone down a little bit to 14.04. But I feel like I've kind of got response back to maybe leave it at the rate where it is this year, the little bit higher rate, so we can whittle on our
Unfunded.
unfunded balance down a little bit.
So you're looking at
So,
recommending that we keep it at 14.31?
yep.
And what's the difference financially?
It would be 14.04.
Right, but
I
do
don't
we
have any
have,
dollar, I didn't bring any dollar figures.
that's what I'd like to know.
It's based on gross budget.
Because depending on how tight the budget is, you may need it in your budget versus paying down your unfunded.
Well, that's easy to figure. It's 27 times whatever our total is.
Payroll, yeah,
Yeah,
Total payroll.
yeah, so
yeah.
you can give us that figure when we start
Oh, yeah,
massaging figures. Yeah.
yeah.
But are you asking us to vote on the rate next Monday?
Well, we can, but we don't have to. I can give you the figures next Monday, and then I'll bring it to court. I just wanted you to be aware of it for the budget hearings and so.
Because aren't we on some type of schedule to wipe out our unfunded liabilities over a period of 15 years or something?
I
20?
think it's, yeah.
20 years.
20 years, okay.
So, just a thought.
Okay.
Okay, I'm done. And now I turn to,
All right. Let's see.
Again, that's barring another stock market issue.
Yeah, yeah. Everything's got a but or if in, or an and.
Yes.
One sec. Don't be alarmed, I'm not gonna drag you through every page of that, but. Oops. Okay on here. Thank you. Thanks. Okay, so I'm Charlotte with the Texas Association of Counties. Thank you guys for having me here this morning. We are at TAC, of course, in the process of the annual renewals. We have, out of our 198 counties who participate in the health pool, about 150 renew on October 1, so this is our busy time. The board will be meeting on Wednesday to approve the rates for next year. It looks like our average pool, across the pool, is gonna be just under 6% this year. And I took a glance at your year-to-date numbers, and y'all are looking pretty good, so I'm gonna estimate that you're not gonna be much above that, if above that at all, so that's a pretty decent renewal number.
6% increase in healthcare
Yes.
premiums.
Yes, sir. So what we've been doing at TAC is doing a lot of traveling, because TAC has invested in a little bit more staff. Most of you, or some of you probably remember Kelly Colozzi. She was the benefits consultant for y'all for a number of years. She retired in December, and when she retired, they divided the state in two more ways. So now the state of Texas is divided into 4 territories for your benefits consultants, and I'm the consultant for Southeast Texas. I will tell you that I was the HR director for Bastrop County before joining TAC, so I'm familiar with county government and the issues that Rose contends with, and payroll and benefits. I've been doing that for about 25 years, so got a history and understand benefits, and I also obviously understand what an impact it has on your budget. So again, TAC has added some wellness consultants, added 2 benefits consultants, primarily in response to the Affordable Care Act and what it is doing to health plans. Hardin County's health plan is already non-grandfathered, so you don't have that issue to contend with, but about 80% of our counties are still grandfathered. Going non-grandfathered does add some cost to your plan, and I think you saw an increase, not a terrible increase your second year with us, but it does add some cost. I'm going to briefly go through this first PowerPoint with you. The first slide is regarding the timeline for healthcare reform. Most of this, I'm sure you've all heard, most of the impact happened in 2014. Elimination of the pre-existing conditions, the change.
Which one are you dealing with?
Oh, this one, healthcare reform and controlling your cost. So in 2014, the individual mandate came into effect. So what we have is the public marketplace that everybody heard about ad nauseum. About 8 million people ended up signing up, they say, by the end of open enrollment. And of that 8 million or so, about 80% are eligible for federal subsidies. And so the federal subsidies are a tax credit or a direct payment to the insurance company for a portion of those folks' premiums. And so for those of us on the employer side who have insurance through our employers, we have some fees that our employers are having to deal with to help stabilize that market. The second slide here talks about those fees. The first one is transitional reinsurance. For this year, 2014, that was $63 per belly button, we call it. So every person on the plan, it was a $63 fee. And for this first year, 2014, TAC did pay that for pool members. And in 2015, they'll be voting on Wednesday. It'll be $44, and we anticipate that we'll pay that again. That tax, or that fee, basically, is generating about $25 billion over the first 3 years to help stabilize the public market, and also, to pay some toward those subsidies that people are getting. We do this little research fee that's built into your rates. It's $2 per member per year, so it's cents per month. And then the big thing that I'll be talking about a little bit more with you guys is the excise tax. I believe that Commissioner Pelt alluded to earlier. It comes into effect in 2018, and it's a tax on healthcare plans that cost over a particular threshold. It's listed here, $10,200 for individuals and $27,500 for family coverage. You can see there that they expect that tax will generate over $80 billion in the first 5 years, and that money is what is earmarked primarily to pay for the subsidies. As I mentioned, you're already non-grandfathered plan, so it's not a big concern for you. I will, just very briefly, the big difference between a grandfathered and a non-grandfathered plan, and the reason that they cost more, is because non-grandfathered plans have to provide quite a few services with no cost sharing by your members. And so for your employees and their families who are on the coverage, because you're non-grandfathered, their wellness visits are free, birth control for women is free, childhood immunizations up to 18, all your age and gender appropriate testing such as mammograms, bone density, colonoscopy, I say free. They're free to the member. There are no co-pays. There is nothing that you have to pay toward your deductible. But what that means is that the entire cost of those services is charged to your plan, so therefore it drives rates up just a little bit. So that's, you know, the big thing for being non-grandfathered again and why it costs a little bit more. In 2015, on the next slide, we talk about 2015 and 2016. Not a real concern for Hardin County because you're already over 100 full-time employees. Some of our smaller counties are on the bubble and, you know, between 50 and 99 and all of that, but you guys are already past that point. So again, as we mentioned earlier, because you have over 100 full-time employees, you have to offer coverage to at least 70% of them in the first year and at least 95% in the second, in 2016 and going forward. Next slide talks about the measurement period. You guys, we've already been through that this morning, so I'm not going to spend a lot of time there. The pay or play decision, you know, I hear at some of our conferences and hear, you know, every once in a while I run across a judge or a commissioner and they'll say, well, you know what, this stuff is so expensive, it's ridiculous, you know, why are we even offering, there's a public market, everybody can go buy insurance, you know, why do we even want to do this anymore? And that is an option. I will say that I haven't come across a county who's gone that direction yet. If an employer, though, if they were to decide that they weren't going to offer coverage at all, there is a $2,000 per employee per year fine, penalty, whatever you want to call it. The government calls it an employer shared responsibility payment. And so you would have to pay that for your full-time employees to the federal government should you decide to drop your coverage, which we don't, of course, recommend. If you continue offering coverage, there are some conditions. The only one that I think would impact Hardin County is going to be the affordability test, because you do ask your employees to pay something toward their own coverage. But if $20 is not going to affect you. It can't be more than 9.5% of the employee's Box 1 income, but again, $20 is not even approaching that. So not a big concern at this point. If you should decide at some point down the road that you're going to ask the employees to pay more, then that is a calculation that you would need to look at. Going on into the Cadillac tax, the next slide. This is for you here at Hardin. I think this is something that you are going to need to start thinking about. And the reason I say that is that, as we mentioned earlier, your premium today is $779.88 per month for your employee-only coverage. And it's just over $2,000 a month for your family coverage. The threshold by the time you get to 2018 is going to be $850 a month. So you're not, you know, terribly far away from that already. What we did at TAC is we have an outside consulting firm, Towers Watson, big, huge actuarial insurance-related firm, and they did for each of our counties. They did an assessment based on your current rates and based on your group and the demographics in your group. They did some estimates of this excise tax, and their estimates are that if Hardin County continues at a 5% trend, and I mentioned that your increase this year is probably going to be in the 6% range, but at a 5% trend between now and 2018, the estimate is that your first year's excise tax will be around $88,000. If you were to go at an 8% trend, so, you know, 5 is 88,000, 8% trend would be $191,000 in 2018. Now it's going to go up each year. The excise tax is the threshold, that $850 a month that we're talking about, is indexed. Currently they have the way that it's written, it's indexed to the CPI. Now the CPI just goes up maybe 2% a year, and we're talking about medical trend going up between 5 and 8% a year. So you can see that spread is going to get bigger from year to year. So the caveat obviously is, this is the federal government, this is the Affordable Care Act. There will be changes, obviously, there are changes still, it seems like every 6 weeks, but at a minimum every few months, something is tweaked, something is postponed, something is whatever. The thing that I would caution you about, though, is, and we say this to all of our counties, we're trying to come in and help counties be prepared for what's on the books today. I mean, it's not a bad thing to try and hold your rates steady, regardless of excise tax, no excise tax. You still don't need to keep climbing up in terms of your rates. And the other thing is, as I mentioned before, if 80% of 8 million people are getting subsidies, that money has to come from somewhere. So we don't really think that the excise tax is going to go away. I mean, we're optimistic that it'll be tweaked and it won't be as bad of an impact as it looks like for you right now. But I really, really would caution you not to do, Scarlett O'Hara, we'll think about that tomorrow thing. You need to be thinking about it now. What we really don't want to see is, we don't want to see counties in 2017 all of a sudden go, oh my gosh, we've got this huge tax, we're going to triple the deductible, or we're going to drop the health insurance entirely, and have that shock to your employees. So the reason that we're going around and talking to counties today in 2014 is to help you take steps over these next 3 years to hopefully control that rate, keep it from climbing, as much as we possibly can, so that you don't have that shock to your employees, and also so that you don't have, $100,000 or $200,000 tax to pay in 2018. Okay, so the next slide, and I'm not going to spend a lot of time on all of these. Generally, when I'm traveling, I have a wellness consultant with me. Rosalinda is your wellness consultant, and she couldn't be here this morning. So what our wellness consultant does then is goes into a little spiel, or whatever you want to call it, but talks about, okay, what we've given you the problem. The problem is you don't want your rate to keep going up because of the excise tax, but because of budget in general. Like I said, it's not necessarily even just that. You just need to control your rate increases, right? So the 3 ways that you can do that. The first one that most people jump to is the plan design changes. That's what I was talking about. If you raise the deductible or you raise the co-insurance, you're transferring more of the cost onto your employees, but it does keep your rate down. We like to say that that's our last resort because, again, it impacts your employees, which then impacts how good your benefits are, which then impacts, recruitment and retention, right? Because part of the reason I'm assuming that they work for Hardin County is because you have good benefits. So the other 2 options are to lower cost, the actual cost, and then to lower the usage. So lowering the cost, we have through Blue Cross with TAC now a free service, Benefits Value Advisor it's called, and it's a call-in service for any of your employees or their dependents on the plan, where they can call in, and Blue Cross will actually do cost comparisons for them and schedule appointments for them. Make sure that their provider is in the network when they're making a recommendation for a particular service. And Blue Cross has done this in 2 or 3 states for the last 2 years, and do realize a savings for people who do some comparison shopping and look for not a quality issue, because people say, well, I don't want the lowest cost way. It's some quack and they'll get sicker. But obviously that doesn't save costs, because if you go into the hospital and you get an infection, then that's going to cost more in the long run. So Blue Cross is not going to recommend low quality providers, but you would be surprised at what a variation in cost there is, even for good providers. So what we're trying to do again is we're trying to encourage counties to encourage their employees to get involved in some cost-saving consumer behavior with regard to your benefits, and also the usage, which is tied to wellness and lifestyle. The question here, why should your county consider taking wellness to the next level? Obviously, you want to keep benefits as good of benefits as you can afford for as long as you can. Keep your rates down. Avoid the Cadillac tax. Healthier employees, it's all kinds of studies that the healthier they are, the less they're absent and the more productive they are. So that's all seems pretty common sense. why should your employees care? Again, they want the best benefits that you can afford to give them, and the better they manage their usage of the benefits, then the lower the claims, and therefore the better the benefits you can pay for. And then we have a slide, they talk about retirement, after retirement, how much people generally spend on health care. It's over $150,000, the average, between retirement and death, over and above what Medicare pays. And so the healthier you are as you age, most of our counties, the average population in a county across the state of Texas, compared to the private sector, they're about 14 years older, the average age of your employees. And so you'll have a lot of folks that are working and, moving toward retirement. The healthier they are when they retire, the less it's going to cost them. Maybe they can go have some fun, instead of spending all their money on a doctor. The percent of chronic disease caused by lifestyle, you can see that these 4 conditions, cancer, stroke, heart disease, and diabetes, drive about 80% of the healthcare cost across the country, and that's true in our counties as well. And so 80% of the cost of your claims is related to these, and as you can see, the vast majority of them, over 70% for all of those conditions, are caused by lifestyle. We say that if they're caused by lifestyle, they can be reversed in some cases, slowed down, prevented, whatever, by lifestyle. And so that's another really important reason for looking at wellness. I'm going to skip over a couple of slides to this diabetes. There's a slide about diabetes. It talks about the leading drug for diabetes is metformin. And they say that lifestyle is twice as effective as the leading drug at controlling diabetes. Physical activity, it's phenomenal what physical activity does for you in terms of preventing or slowing down the most common both health conditions and just general lifestyle issues as we age. So the cost control, I talked about the cost control, the benefits value advisor. We have a 24-hour nurse line. Rose is aware of this. I'm sure she's given your employees information about it over the years. The 24-hour nurse line, we do see another cost control measure that we really encourage our employees to think about is emergency room usage. We have a county, not your county, but in this territory that we looked at, they had 12 emergency room visits for sinus infections in the first 6 months of this year. Well, a sinus infection is not a life-threatening condition. A visit to the emergency room, the average is about $1,200 to $1,500 per visit, as opposed to a primary care physician visit, which is about $200 per visit. And so you can see that if you have a handful of people who, even just that, something as simple as that, what it does to your claims. So this 24/7 nurse line is for anyone in the family. It's not just the member. You can call in and, my child has a fever, should I take him? And the nurse line they go through a series of questions, if the fever goes past this, or if it goes past this many hours, or, whatever, to give the member some guidance on whether and when they should go see a provider. And sometimes, we have anecdotal evidence from county employees that this has been very helpful to them. So again, a way to keep those claims down. Condition management, those conditions I talked about earlier, diabetes, cholesterol, high blood pressure, asthma. For any member who has one of those conditions, there's a program through Blue Cross called Condition Management. TAC has a program in place that if you participate in that, then TAC will pay for 50% of the copay for your medications. So if you're on high blood pressure or high cholesterol medication and you participate in condition management, your copays for your medicines are 50% reimbursed by TAC. Condition management, not a big deal. It's a coach who calls about once a quarter and talks to the member about how they're doing. Diabetes, for example, making sure that they're going to get their eye exam or their foot exam, and just that continuation of care, all of the side effects of a particular condition, making sure that they're taking their medicine. Blue Cross will monitor prescription refills, for example, And if you're not refilling as often as you should be, then clearly you're not taking your medication like you should be. So that's kind of what condition management does. It's not real invasive. And again, a well-managed condition does not lead to the higher claims typically that a non-managed condition will lead to. The benefits value advisor I already talked about. What we're doing, the wellness people in particular, and we've been to, gosh, I don't even know, I've been on the road so much the last 3 months. What we're doing is we're going into counties now with obviously the court's permission and doing what we call empowered employee seminars. What that is where we visit with your employees. It's a different presentation than this, not these same slides. A couple of the slides are the same. But the point of these employee sessions is to get your employees, to give them that connection between how they're using their benefits and the county continuing to offer them and to be able to afford them. And so it's connecting the dots, how the benefits actually work, how their plans actually work. We're talking to them about the benefits value advisor, condition management, nurse line, lifestyle, wellness. We're talking to them about all of those things. And we're finding that employees in a lot of cases don't really understand how the benefits work. They have a sense, they take their card, and you guys have a $25 office visit copay. So they take their card, they go to the doctor, they pay $25. Excuse me, and a lot of times they have a sense that that's what it costs, $25 for me to go to the doctor. And they don't realize that behind that $25, there's another $200, $500, whatever, that is going against the plan, that is costing the plan. If they have to go get an MRI or a CAT scan or mammogram, whatever, not realizing that it cost $1,500 at this facility and $3,000 at this facility, that they could have saved both some out-of-pocket dollars and some cost to the plan. And really getting the concept that the more they're costing the plan, the harder it's going to be for their court to continue paying for that same plan. So it's really good information for the employees. It's we're even Road and Bridge can be some of the toughest folks to talk to, but we find that they have a lot of questions, that they're very engaged, and I think that it's definitely beneficial as, again, we move forward over these next few years and not wanting to have to make dramatic changes to their plan, to let your employees know that there are ways they can help keep that from happening. So that's what those are for. And the other thing is to get people engaged in this kind of thing, to get people engaged in wellness. I know you guys do the pedometer program? Mm-hmm. Okay. And so TAC has already got Healthy County. You have the pedometer program that's available to you. You have the fruit and vegetable 5-a-day thing in the summer, I guess, late summer. Then we have a holiday maintain no gain program. We have quite a few Healthy County programs already. And what we see across most counties is about a 20 to 35% engagement rate, meaning about 20 to 35% of the employees participate in these programs. But what you really need to see to have any real impact on your claims and your rates ultimately is at least a 70 to 80% engagement. Yes, sir.
On that, it's hard when, like, if you're gonna wear the pedometer, that you have to go check into a computer when you gotta work 10 hours a day. And
Yes.
you gotta patch roads, build roads, grade roads.
Sure.
You can't send your guys to purchasing at 3 o'clock every afternoon to check in.
Right.
And so for, say, my 11, 12 employees, that's a non-workable program.
Do you have a computer in your
Oh, absolutely.
barn?
Absolutely.
So we could get you a transmitter for your computer in your barn?
I have no idea if you can, but what I'm telling you is here, we check in at purchasing, and then it's not a convenient thing for our guys to do, and so it's hard to get them on board.
Right.
I want to interject something there, if I may. We also do the Weight Watchers, and that's at 5 o'clock here at the courthouse. And we have all we can do to get enough people to come do it.
I would have done it if it wouldn't have been on Wednesday night, but I can't do Wednesday nights.
And then also we had our health fair last week, and I think we had about 58 people come to it. That's a free service, and it's an excellent service. But you know, considering how many people we have, that's not a lot of people to take advantage of their, benefit. So, you know, we gotta have, I don't know if you could make it mandatory, but, you know, if you go do that and you discover that you have an issue, and it's at the beginning through blood work, you know, it's easier to be fixed early than wait till later. But what I get is, I'm afraid of needles, or if there's something wrong with me, I don't want to know about it. And you know, you can't make people do anything if they don't want to themselves be
Right.
wanting to do it.
And again, that is these employee sessions where we talk to the employees directly. First of all, it's TAC, it's somebody from the outside coming in, it's not Rose, it's not, you know, their supervisors. It seems like they accept it a little bit better, but it's getting that understanding that exactly what Rose said, you know, all of these resources are available to me, and why should I care? Well, first thing, obviously, for all of us is, well, you should care because you'd feel better if you felt better. But that doesn't drive a lot of people. But the combination of that with the financial implications of not taking a little bit of care of ourselves, better care of ourselves, or not, you know, doing the screenings and the annual physical, getting them to start understanding the importance of that is it's huge for them, and it's huge for the county in general.
Well,
So-
I'd agree, and, you know, I'll just say, you said, you know, road and bridge employees are hard to work with. You know,
Yes,
road
sir.
and bridge employees are hard to work with, is
Mhm.
what you said, and then I think since road and bridge make up a probably large portion of what TAC has to cover, then maybe there should be some tailor-made programs for road and bridge. For instance, they start earlier, they have, work a 10-hour day, not an 8-hour day.
Right.
And so there's things unique to road and bridge where oftentimes it's about the courthouse.
Right,
And
okay.
don't mind, but these guys are here 8 to 5, Monday through Friday. And, you know, like for instance, our guys, if they can do something at 7 or 8 o'clock in the morning, their self-esteem's a lot better versus coming in the courthouse 3 o'clock stinky with asphalt and
Yeah.
oil on their feet.
Okay.
And so maybe it's something that, I don't know if y'all have brainstorming sessions, but what in particular do you have that could be tailor-made for road and bridge if they are the hardest people to work with? But there may be reasons, and then are any commissioners on any of these panels that give advice? And I'm sure there are, but,
Yes.
you know, and are these concerns being brought up? Because I share the concern with you, but it's one thing to say, okay, this is what we need to do versus, okay, what are we doing to try to get them on board?
Right.
You know, because I'm sure road and bridge makes up a large portion of covered employees, them in the sheriff's office.
Yes, sheriff's office, and I was gonna say, jailers, that's the other group that we, you know, that it's hard to reach them. They're a 24/7, they work nights. These employee meetings, we're doing at 7 in the morning, 7 at night. We're doing them whenever you need them done. That's the first thing. The second thing is if we get you transmitters in your barns so that they can participate in the pedometer program, and I think most likely next year, instead of pedometers, it's gonna be the little wrist things, little bands that you wear on your wrist, which is a lot easier. You don't have to remember to change it on your shoes, or you can't attach it to your work boot or whatever it might be. Yes,
Okay,
sir.
wasn't there also something you had to go on a computer and do?
The health risk assessment,
Okay, but wasn't there something other than the health risk assessment you had to do? Because you gotta understand, a lot of our guys in road and bridge, they're scared of a computer. And for
Yes.
me, once I realized that there was something either on a weekly or daily basis you had to do on the line, because I was wearing the pedometer to support the cause, but once I found that out, I thought, man,
right.
you know, it's not 1 or 2 steps. Now you've got all of these, you gotta come check in, make sure your foot passes by the computer, and sometimes it does and sometimes it don't. Right, then you want to go get online, I mean, and so.
Right, well, you don't, the first program, the PATH program, a
Because
couple
you
of
get
years
points.
ago we did.
You get points, and then your
Right.
points determine where you end up in the little
Right. as far as
category
the
of
gifts and
competition.
stuff,
Right, but
Yes.
if you have too many steps, especially for
Mm-hmm.
just an old hand
yeah.
who's gonna eat dinner at Mama Jack's,
Right.
all right? If you got 10 steps, he's not gonna do it.
Right. Well, and I understand that. And I think that, yes, in terms of looking at it from our perspective, the Healthy County Programs perspective, we are trying to take into consideration that we have folks who don't want to mess with a computer, don't want to wear anything, maybe even. The software that we're using, as I said, we're looking at switching to a company that we could use the wristbands also with a mobile app. So we find that a lot of even the road and bridge guys that don't have computers have smartphones. And so, almost everybody has
But remember,
has
this
an
is
iPhone
county
anymore.
issued,
Oh, they are here. Yeah, see, that's
Okay.
different from county to county, so,
yeah. We're not
anyway.
smartphone people.
We are happy to sit down and work with commissioners, work with sheriffs. There is, in fact, a program coming out for sheriffs and EMS and fire, a Fit for Duty it's called, and that program is specifically geared toward first responders and law enforcement that combines some of this wellness with fit for duty. So the importance of being fit so that you don't get hurt on duty. And I think, tailoring that maybe a little bit, tweaking it a little bit to road and bridge and maybe maintenance, some of your folks that are physically active, is something that we're looking at. So, and I understand what you're saying. But back to the driving employees' engagement, which is what we need and what you need in order to move that needle at all in terms of your claims. A gift card or a water bottle or a t-shirt or whatever, there's not a lot to that. You'll get 25, 30% of your people who will do it. Of that 25 or 30%, probably at least 15 were gonna do it anyway. At least 15, half of that group was already healthy. They're already running or walking or whatever it is they need to do. So what TAC is recommending is an incentive program that's tied to the benefits. When I say it's tied to the benefits, that's exactly what I mean. It's tied to the benefits in that it affects how much the benefit costs, but it doesn't affect your budget. And so if you'll go all the way back to this recommendations sheet, it's almost to the end of this packet. We have a couple of things that we recommend. And you'll have to forgive me on the option A. It says continue plan 1100. That should be 800. You have the 800 NG plan right now. Your members pay $20 a month, by and large. But right, it's if they were hired after a certain date, they pay 20, and if otherwise they don't pay anything.
Non-employed only is $20.
Okay, everybody pays that.
Okay.
Okay, so currently they pay $20 a month for their own insurance. The way that this would work, you would incentivize participation in some activities. So what you say is, okay, we're paying all but $20 a month today, and we'll continue paying all but $20 a month in the next year, but we're going to ask you to do something in return. And what we're going to ask you to do, and over to the right you see these are some. It's not a given. The county gets to pick what they want to use. But we're recommending that you say you need to get an annual physical. You need to do the health risk assessment, which again is online, but we can come out and help your employees do that, the ones who don't have computers or need help with that. If you're eligible, if you have one of the conditions that we talked about earlier, that you participate in condition management. Another possible requirement is requiring them to be active at least 3 times a week, and by that I think they're saying it's like 30 minutes of activity 3 times a week for 40 weeks out of the year. So you're allowing 12 weeks of whatever, vacation, illness, I don't feel like it this week, whatever, but over a 40-week period out of a 52-week year. And all of these requirements are monitored or can be monitored by Blue Cross. So it's not something that your internal HR department would have to keep track of. Blue Cross can do this assessment, and the only report that your HR would get at the end of the year would be a list of the employees who completed your requirements. Doesn't say which ones if they didn't complete them all, it doesn't say which ones they didn't complete. All of the stuff that I talked about is HIPAA, subject to HIPAA requirements, so privacy is very important. But what you say, again, is whatever you set up as your requirements, if the employee does meets those requirements, that you will keep that $20 a month contribution requirement for them. If they choose not to do that, and they can choose not to do that, they can say, I don't want to mess with it, I don't care, then what you say is, okay, well, your premium contribution will be $50 a month instead of $20. So it's neutral to the county, doesn't cost you any more money, but it gives the employees some incentive. That's $360 a year, basically, that they would save by meeting those few requirements. And so that's one way that you can do it. The other option is on the next page, and that's a deductible. Your current deductible is $500. If you move to a plan with a $1,000 deductible, it's kind of the same thing. You would say if you're willing to meet these requirements over the course of the year, you will stay at a $500 deductible. If you choose not to do that, then your deductible is going to be increased to $1,000. Again, it doesn't cost the county any more to implement those. And we do find, and I say we're just introducing this to counties, but Blue Cross finds across the country, both in private and public sector, that tying an incentive to the benefit plan in this way really dramatically increases employee engagement in these, and they're not, an annual physical, that's what, 2 or 3 hours once a year that the employee has to invest. But as Rose mentioned, if you can catch a condition early and save a big claim down the road, that's the reason that annual physicals are considered so important. Same thing with the health risk assessment and then condition management. So that is something that we'd like for you to start thinking about as a court. Real quickly, I know I'm running out of time. This other presentation, the private exchange, this is a new product that TAC is offering this year to counties. And basically what a private exchange is that it is a defined contribution plan as opposed to a defined benefit plan. So currently what Hardin County has participated in is a defined benefit plan. And so you have a plan. This is, $500 deductible, $25 office visit copay, whatever. You have a single plan, and these are the benefits. They're defined. And every employee has this. If you work for the county, this is your insurance plan. A private exchange is a defined contribution plan. And so what that means is the county says, we're defining the contribution, and you as the employee get to pick a plan, okay? So you're currently paying $779, $780, let's just say, per employee. So you might say, okay, in the coming year, what we're gonna do is we're gonna pay $800. Everybody's gonna have $800. That's what the county will contribute. And then the employee, there's a list of, a selection of 10 different plans. The employee says, okay, I've got $800 from the county, and if I want a little bit better plan with a lower deductible or lower copays or whatever, then I might have to take a little bit out of my check. Or if I never use the insurance, then maybe I want to do a health savings account plan where the county is putting some money into an HSA every month, or I can put some money into that account every month and then save it for down the line, because the money never goes away and it does earn interest. So in 2 years when I need, bunion surgery, or, if I've got if it's me or I've got my wife on the plan and we're going to have a baby, in a couple of years we'll have this money in our HSA to use toward our deductible. So it gives the employees some options. This is in response again to the Affordable Care Act, and also in response to counties who have told us we can't afford to keep going up on rates. We can't afford to keep paying more and more and more. So it allows the county again to set just a set rate, and you can set different rates across the different tiers. So I think currently, Rose, do y'all pay the same amount for everybody, or do you pay more for dependent coverages? You pay more, yeah. So you can still do the same thing. You can say we'll pay $800 for employee only, and $1,000 for employee and children, and $1,200, however you want to set that contribution. You can still do that. But again, I'm going to just go through this really quick. If you look at what the different plan options are, you can see that you guys, your current plan is kind of right in the middle, that 800 with a $500 deductible. Our average deductible across the pool is $750 right now. In the private sector, the average deductible today is about $2,500. But the plan deductibles go anywhere from $250 up to $4,000 for the HSAs. If you switch to go on to that very next page, it's an example for you, Hardin County. And you can see based on your current rates that you're 700 and basically 59 because your employees are paying $20 a month would buy the 1200 plan. So the reason that the dollars you're spending today for the 800 plan would not buy the 800 plan on the exchange, the main reason is risk. For this first year, there is a risk factor built into the exchange because the underwriters, they have to plan for adverse selection again. That would adjust, we believe that'll adjust in coming years. But what you can see is, let's say for my example, if you told the employees, we'll pay $800 towards your coverage, and you can see what the coverages cost for the different plans. Your employees, again, have the option of buying up. If you were to put money into their HSA, you could put the difference between your contribution and the HSA plan. The lowest, their highest cost one is $628. So let's say that you put a couple $100s a month into their HSA. That would apply toward, they could use that to apply toward that higher deductible. So the advantage to this to your employees is that it gives them some choice. If they can't, you only have, it looks like, 4 people who have their families covered today, 13 have their spouses covered. The advantage to your employees is they can look at these plans and you can see that there are some that cost considerably less for the employee and children or employee and spouse coverage. They might say, in order to put my family on, to be able to afford to put my family on, then I'm going to take a little bit lower cost plan. Or they might, again, want to choose a health savings account plan. The advantage to the county, budget predictability. I mean, again, if you just set a rate, you say $800 and next year will go up by 5%, when you get ready to look at your budget, you're not so much concerned about waiting for what tax rates are going to be coming back to you. You know that this is what you're going to contribute to the health plan. There are also some, studies, again, just nationally based studies that argue that employees do prefer having a choice. They are happier when they have a choice. Speaking of employee choice, there is a very, it's simple, it is on the computer, but you can do it by phone as well. It's an 800 number for people that don't want to mess with the computer. But this survey that they take the employees through as they choose one of these plans, it's fairly detailed. It asks a lot of questions, again, completely private. You as the employer would never know what the employee's answers were to these questions. But they ask them financial questions, health questions, lifestyle questions. And as they answer those questions, it guides them toward the particular level of plan that it seems like would be best for them. And Rose, I think, you went through the demo, the webinar demo of how that is called a survey works. And so there is a lot of guidance available to your employees. They're not just like throwing this chart and, okay, we'll pick a plan. There is a lot of guidance that goes into helping them choose the plan that best fits their particular circumstance. And so we're introducing this again to, it's a cost containment measure. It's also in response to what's going on in the marketplace. If you read anything about insurance in this day and age, you are probably seeing a lot of talk about private exchanges. So it is an option that's available to you as a court to look at for your employees. I will say that one of the downsides to it for payroll is just it is some extra work, because instead of one plan, you got 10 plans, and you're going to have employees on a lot of different plans. So something to be considered. I do appreciate your time. Yes.
One more question.
Mm-hmm.
I know it's still early in its genesis, but has TAC had any counties reduce their rates to the Healthy County program? Is there like a county you can say they've hit this thing full force and they've lowered their rate by 1%, 2%.
Mm-hmm.
Because if we're gonna ask citizens to fund the incentive program, because that's what we're gonna do, we're gonna ask citizens to fund the incentive program, because we've got the rates, tax rate to do it.
Okay,
Right, then what overall, in other words, if we're gonna spend money to
Mm-hmm.
give away gifts, to get people to lead a healthy lifestyle,
Mm-hmm.
what resources do we have to say, well, there is a county in West Texas, there's a county in Central Texas, they reduced their rate by 2%, it saved them X amount of money over X amount of period of time. In other words, what's gonna be, you know, where's our leverage in offering the program? And I know it's early, but, and I agree with everything you said, and I love the incentives. But right now, our county doesn't offer anything, we don't have anything even budgeted for
Right,
incentives like
and-
that.
and what I was saying about the programs that you have in place right now, the Sonic Boom program where you get the gift card, or the health assessment where you get the cover, that's, TAC is covering that. It's already, it's built into what you're paying in your rates, so there's not an additional cost. The incentives that I was talking about in terms of tying the incentive to the benefit doesn't change the county's cost. It changes the employee's cost, doesn't change the county's cost at all. So that's the first thing. The second thing is that no, because this is a new push, basically, we've had Healthy County in place for several years. It's hard to say. Now, my wellness people might, I'll go back and ask them if they have on counties where participation was pretty high. What were their, you know, what are their rate? What's it doing to their rates? Can you tell if there's a trend in their rates? I know in Bastrop County we were, you know, pushed it pretty hard from that first program that came out, and we had pretty stable rates. I mean, they creep up by virtue of medical cost. It's not all usage, obviously. A lot of it is on the cost side. I did feel like in our county there, that it was having an impact, but we were very engaged again in talking to our employees about why they needed to do this one. Besides just, yeah, okay, you need to lose 20 pounds, whatever. No, it was a lot more than that. But statistically, I'll see if we have anything. But this is, again, relatively new because in response to ACA and in response to the excise tax and, the continued increase.
Well,
But
for
I
us,
hear what you're saying.
for us, it's a tough political climate.
Oh, absolutely.
And so, not only do we have to sell the changes with employees,
Mm-hmm.
We're influencers in the community. We gotta sell the taxpayer.
Right.
These changes are important. So does TAC give away the shirts and the T-shirts and all that you were talking about? Y'all do that?
Yes.
Okay.
Yes. And from a taxpayer standpoint, again, I think if you look at your benefits, which you're currently offering your employees, that $500 deductible and $25 office visit copay, I think compared to private sector, those are still really healthy benefits. Even with a $20 contribution, I don't know about in this area in the Houston and coming north of Houston. I know in the Austin area, the private sector, typically the split is 50% employee to employer portion. So instead of $20 a month, it would be almost $400 that the employee would be paying. So still very rich benefits. But I certainly, and again, this is something that we even mentioned to your employees when we talk to them is, the commissioner's court is dealing with budgetary pressures, using taxpayer dollars wisely pressures, and, needing productive employees. And so all of that comes into play. This stuff that we're talking about, the benefits value advisor, the Healthy County programs, is cost neutral to you. There aren't additional costs associated with participating. There are no additional costs associated with having wellness consultants come out and do these employee presentations, having us come out during open enrollment to help explain your plan if you were to make some plan changes. None of that, it creates any additional cost to the county. So,
Thank you for taking time with me today.
okay. Any other questions? All right, thank y'all so much.
Thank you, Sean. As a matter of record, I want this on record.
Okay.
Bobby and I can't get into the iPhone, but if you got a can of string, come see us.
I don't need an iPhone, I promise.
Next Monday, we're gonna tack the, workshop as an agenda item so that we can go right into it without having to keep you over.
And what are we gonna be looking at next,
We're gonna have Wayne and Angela are gonna make a presentation to give you what kind of view we've got of the information as far as revenue and expenses at this time.
Okay, and on this, health insurance, you say that y'all are meeting and you're gonna be setting the rates here.
On Wednesday, the board will approve the
Okay,
rates.
so
on
we'll know
Wednesday.
what the rates are for employee and all the different brackets.
I can get that to Rose.
And then Rose, can you provide us with a schedule of the amount of people that we have that are grandfathered, not grandfathered, because that's a different situation, right?
They're all in the same.
Okay, but we got a lot
Oh,
of,
you're talking about the dependent, you're talking about
yeah,
something
yeah,
different?
all of
Yeah,
that. We've
okay.
got a lot of people that are not grandfathered that I
Yeah.
assume are not even on these programs, right? Maybe
Yeah.
employee only, but they don't have their family on it.
Yeah, we have a lot of employees who don't have their dependents on.
Could we see a schedule of who is and who's not in the different categories?
Yeah, I can tell you,
Okay.
but also, you know, we have employees with dependents that pay a different amount versus employees with no dependents. The new people that came in, they paid $20. The county doesn't pay anything towards the dependent coverage. But they-
That's on non-grandfathered.
Right.
Yeah, on all new
And then
employees.
we have the grandfather people where the county still pays a portion
Yeah.
of the dependent
Yes,
coverage. Yeah.
that's what I'm telling you.
Yeah, okay.
So Monday, instead of 1:30, it'll be in the morning.
We'll just,
After
it'd be right after court, we just move right into it. That
Now,
way
like
we-
this $20 we talked about, that's just an arbitrary figure that the county picked out, right?
The employee pays $20 towards the $779
On employee only.
on
But
employee.
I say, is that an arbitrary figure that we just picked out at some point in time?
It used to be $10 a long time ago, and then it was changed to $20 a long time ago again. And it's been-
So that can be whatever the county sets it at.
Yes, that
Okay.
can be changed.
So it looks like the 6%, we're looking at about $100,000 increase in county's obligation this year. I mean, that's just ballpark. Okay.
We have anything else? We have a motion to adjourn?
So move.
We stand adjourned.
Visit with, on that land that Esther brought back to us, Mr. Pelham, I talked to you yesterday.